Hi, I'm Dr. Steve Amoils. I'm the co-medical director of the Alliance Integrative Medicine in Cincinnati, and I'm a member of the American Academy of Medical Acupuncture. I'm here today to talk to you about the effect of medical acupuncture on fibromyalgia. Fibromyalgia syndrome, as we know it, has been around for thousands of years. I like to think of the term algia, or the root term, coming from the word fibromyalgia, algia meaning pain, and fibro meaning the fibrous, and myo the muscular parts of the body. It refers to a syndrome where patients have chronic pain and fatigue for more than 3 months, and a lot of associated symptoms such as cognitive dysfunction, irritable bowel syndrome, migraine headaches, depression, anxiety, irritable bladder, and a host of other problems. In 1990, the American College of Rheumatology proposed criteria for the establishment of the diagnosis of fibromyalgia, and these were then updated in 2010. The interesting thing about fibromyalgia is that patients often look normal and their labs are normal. So they look healthy, and it's very frustrating because they feel so bad, and yet doctors can't find a cause. And that's why it's important to find a physician who has an interest in an ability to diagnose patients with fibromyalgia. The important thing to know is that medical acupuncture can be highly effective on all the symptoms of fibromyalgia. In our experience over the last 30 years, we've treated literally thousands of patients with fibromyalgia, and we've seen a significant reduction in pain, in fatigue, in irritable bowel, in bladder problems, in anxiety and depression, and all the symptoms associated with fibromyalgia. So the question you may ask then is, how does it work? What does medical acupuncture do? We know that when you put a needle, or you inject, if you inject a tender point with local anesthetic, the pain in that area, that region, goes away. And the acupuncture needle seems to work in a similar way. It has local effects which bring healing chemicals to the site of that area where the needle is inserted and reduce pain. In addition, it reduces pain and spasm. It balances the autonomic or automatic nervous system, and that's how it calms down things like irritable bowel syndrome. And then it affects the central nervous system. We know there's an outpouring of endorphins or endogenous chemicals that make you feel good, as well as changing the way the brain perceives pain. And we can see this on functional MRIs of the brain. So what is your medical acupuncturist going to do? First of all, they will take a history and then examine you, and then do a treatment with acupuncture. In this treatment, they will take fine, sterile, disposable acupuncture needles and insert them at various points around the body. The treatment itself is usually very relaxing, and patients often fall asleep. In summary, if you have fibromyalgia, I would strongly recommend that you consider medical acupuncture. The results can be highly effective. Thank you.